Stroke is a focal neurological deficit, which is of no other origin but cardiovascular in origin.
Depression is the leading cause of disability. Depression on its own is a persistent feeling of sadness, a persistent feeling of hopelessness.
SARS coronavirus, also known as COVID-19, has claimed lots of lives and still threatening to take more lives if a vaccine or treatment is not found. According to the World Health Organization, there have been over 4 million cases and over 294,000 deaths globally. So far, Africa on the global map seems to have the lowest number of cases, with a little above 51,700 cases and a little above 1,560 deaths. America and Europe are presently the worst hit, with over 1.8 million cases and over 100,000 deaths each. The number of infected persons is likely to keep increasing if proper measures are not put in place by governing authorities and if individuals do not take responsibilities for their health and safety. The fascinating part of this pandemic is the rate of recovery. Over 1.6 million people have recovered out of the over 1.8 million cases recorded, and it is believed that more will recover as knowledge about this disease increases. On the program today, we shall be discussing extensively on COVID-19. We will discuss what exactly is the problem with this virus, the National Infectious Disease Bill, and vaccine and treatment, and of course, much more. You do not want to miss any segment of today's program. Tell your family members and friends to tune in to Health Watch on Advent Cable Network Nigeria. I have two guests on the program today. One is Dr. Laz Udeze, and he is a public health expert, and he's a publisher of the talkhealthniger.com. Dr. Laz, you're welcome to the program.
Angela, thank you so much.
You were here before.
Yes.
So it's good. We talked about cancer the last time.
We talked about cancer,
so it's good to have you back on the program.
Thank you very much.
Thank you for coming. And joining him is a very popular face on ACNN, and he's Chukwuebuka Ejekam. He's a public health analyst and he's the presenter of Bible study on this station. I'm your host, Angela.
Thank you. Thank you
okay,
for having
you're welcome to the program. Everybody knows you.
It feels so strange staying on this side.
Stay on this side because you're used to doing the presenter. But this I'm in charge this time, so I'm going to ask Dr.
No, I don't begrudge you.
All right, thank you for coming on the program. So today we want to talk about COVID-19, which is the word on everybody's lip. COVID-19, I think, if you Google it now, that's the most used word globally. Yeah. But let's start with the statistics. Africa seemed to be the lowest, in terms of this pandemic. There are countries that are recording over 1.8 million cases, millions of cases, but Africa is still just barely around 51,700 cases. Yeah. What's going on? What are we doing well? Let's praise ourselves a little. Let me start with you, Chukwuebuka.
Okay. There could be a whole lot of factors that one can adduce. But let me say, first of all, that we had the advantage of having the signals. We say to be forewarned is to be forearmed. Yeah. This whole stuff started in Asia, Wuhan, traveled to the West. So we were kind of a bit warned. Okay. So we needed to be better prepared than some countries that it came upon suddenly, and they didn't have the leverage to prepare like we did. So that helped us, because I'm aware in Lagos, for example, speaking specifically of Nigeria, that the governor and his team started ahead to build isolation centers, and the NCDC started to make preparation in case it eventually comes in. So that kind of helped us. Again, I also feel it came out so clearly in the height of this pandemic that perhaps Africa seems to be still a marginal player in the world, maybe perhaps economically. The volume of travel that happens in the West and in several North American countries is huge. And this virus doesn't travel on its own. It's we humans that travel with it. So perhaps those volumes of travel helped to fast-track the transmission in Europe and in America. Before they knew it, people were on vacation, people traveling for the slightest. Let me give you a critical example. I'm a football lover. I love football. And I know there are people who support certain clubs that travel throughout seasons with the club they support. Whether they're playing in their home country or in another, they've bought ticket to travel around with
for them to get on the train and move.
Just fly in, get on the train and go. So the volume of travel that happens in the West is huge relative to Africa. Travel is more, for us, it's more like a luxury when you get somebody is jetting out of the country. Sometimes we see it more as a luxury. So that volume of travel help to quicken the transmission in Europe, people moving from here and there. And then Africa, we were able to kind of checkmate it. It's not a fiat that we've done maximally well, but at least relative to Europe and the West, we seem to have been able to
So it has nothing to do with government policy or any government?
Government also put up standard precautionary measures because we were warned. But like I said, it's a whole mix. It's a labyrinth of reasons that you can adduce. It's neither here nor there, but there's a whole lot of factors that has helped us as a continent and as a country, Nigeria now, to have been able to keep it at bay.
So do we need to go and rest and say?
No. We are not resting on our earth. No. We are not resting on our earth. It's actually a call for more work. The COVID issue has also presented to us bare in our face the gaps in our health system, issues around research. You are going to be talking about vaccination, health research. There's a whole lot of things. It has given us reason to actually go back, reassess, and then work harder. Because like you said, COVID-19 is the new normal. Things are not going to ever remain the same after now, except we want to be lying to ourselves. If we want to be clear to ourselves, we're going to have a whole lot of re-engineering our health sector and then work harder to make sure that universal health access, issues around maintaining optimal health for our population is taken to the front burner.
That's okay with you. We think that's why we are okay at the moment.
Another perspective is, are we testing enough?
Okay, so there could be more people that have it.
Yeah, definitely. I strongly believe that the numbers we have in the continent is not a true picture of what's happening. But it's also the same everywhere. You know, testing is in every country, even in the West, they also feel their numbers is probably less than the actual. So, but relatively, I don't think, because it speaks to the weakness of our health system, especially in sub-Saharan Africa. So we are not testing enough. We are hearing about mysterious death in quotes. There's nothing mysterious about mass deaths in a period of a pandemic. You understand? You know, so it speaks to the fact that perhaps the virus is moving faster than we are able to follow it up. You know, so that's a fact. But of course, the volume is not anything close to what we probably have in the West. Or could it be that we are more resistant to the virus? You know, could it be we can't really put hand in it? A lot of research is ongoing, study is ongoing. You know, because this is a new virus. So at the end of the day, because a lot of question is, oh wow, why we interact more socially? Of course, you know, compared to the West. So it's expected that because of our social interaction and the way we live, it spreads faster here. You know, so but the death is not to the extent as which what we are observing in the West. So we could say we don't really know what it is, you know, but whatever it is, let it not get worse than it is.
I think NCDC, they acknowledge the fact, and the new target to test 2 million in the next 3 months is actually born out of the fact that perhaps our testing capacity might not be as...
So far we just tested about 30,000 or a little bit above 30,000.
About that. And compared to what America texts on a day, New York alone, we are hearing the figures, is huge. That's like a cumulative of all we're able to do within some periods of months.
China is trying to do 1 million people in 8 days, and I'm wondering...
The stuff is we cannot perform beyond the capacity of our health system.
we have to wait for the kids to come in. Some of this, and then there's I read a literature on when Dr. Last talked about, could it be that there's something in us that makes us more resistant to this virus? Somebody was adducing the weather factor. I don't know how to
long while ago. I know WHO have come to debunk all of that, but
there's so much around it that is research has to come out and validate. But there's a whole lot of issues around it. That's why we are propagating that more research needs to get into these areas.
Just also, and I know there's there's a belief that the virus could be working like the flu virus. And so, flu is highest in the winter. And since there's a reduction now, maybe because we're getting towards the summer, maybe there's maybe something just
close
family.
They're relative.
What you're saying. Okay, so let's move ahead now. Now, SARS-CoV, this is severe acute respiratory syndrome. It's been there. I know there was a virus infection. Have always been there. I know at least I might not talk much about 1918. I was not born then. But
okay,
the flu,
the Spanish flu.
Yeah, the Spanish flu pandemic.
Claimed millions
of lives, yes. But I cannot talk much about that based on what we read.
If
but at least
you were
I know.
born then, I would have asked you if you are.
So we are in 2002. Between 2002 and 2004, I know there was the SARS issue that was all over the place, and we didn't go on a lockdown. It wasn't as scary as it is now. So what's with this particular virus that is making it so scary that the whole world has gone down, not even minding the economic shutdown? We already done. So what is it about COVID-19 coronavirus, or this 2019 coronavirus?
Well, COVID-19 is crazy. Yes. Did you have any confirmed case of SARS in Nigeria?
No, we didn't.
I
can't remember.
Perhaps not on the African continent. Right? So SARS was an epidemic.
Yeah,
COVID-19 is a pandemic.
Yes.
The question is, what's the difference between epidemic and a pandemic? It's just description. It's an epidemic when it's still confined within a certain geographical area. So we had reported cases of SARS I think it started in China or within the Asian region, or Hong Kong, so then we have cases in the US which also related to a lot of travels and all that. So, and it wasn't affecting the number of persons that COVID also affected. The mortality rate or the death rates is also not anything comparable to what we are seeing. So a pandemic is when it's everywhere. If it's in Maidala, it's Uzurumba. So it has gone to every continent, everywhere you have human beings on earth, every country, we have COVID-19. So, and because of the speed at which it spreads, and also the speed at which it's killing people. So I say it required drastic measures to respond to. Even after SARS, you have the MERS, Middle East Respiratory Syndrome, which is also caused by coronavirus. SARS is also a coronavirus that caused it.
So the coronavirus is not like a strange ailment to the medical world. Of course, to the layman, it could be a strange. Because I know there was a movie that was going around and somebody was saying coronavirus, and people think this is a prediction of what is that, but not knowing that coronavirus has always
been there. It's a huge family.
It's a family of viruses. So, but this is a new strain. Just as we are Nigerians. They deliver a new baby today, is also a Nigerian. So within that family of coronavirus, the new baby that arrived is COVID-19. And unlike other forms of coronavirus, this one, the behavior is just
it's quite deep.
So quite devastating to the world.
The mutation happens.
Okay, the rate at which the mutation. How do you mean rate of mutation?
I mean for
this coronavirus,
yes, it's highly mutagenic, if I'll use that word. It's unknown. You need to study it closely because another variant can come up. So those are the issues. The medical world is even still trying to unravel it. To understand this. It hit us and we've not known this before. So they're still trying to study it and get at it. But I just wanted to say something around, just to paint a picture that might help us to understand. When Dr. Lars talked about the pandemic nature of the disease, and I just remember the literature I read yesterday.
Okay.
Somebody says Nigeria, it's an endemic when it's only residents here.
Yeah, okay.
But when it gets a visa and travels and travels out of the world, I just remember that picture because I was reading it yesterday. When it travels around the world, it becomes a pandemic. Then there's another angle, endemicity, when it becomes endemic, that beyond getting a visa to travel somewhere, when he now gets there and has a work permit
and lives there
and stays there,
yes, and does his activities,
then it becomes endemic. So there are a whole lot of issues around the COVID virus, which I know with the effort that is going on across the world, and I'm glad some things are also happening in the African sub-region. Some countries are investing resources to also, we don't have to necessarily wait for the West. With what is coming out, I hope in the quickest possible time, in sooner than we'll think, we'll be able to get away around this to understand it better.
People are experts. I want to bring out something that this is, I'm just talking like a layman, you know. You know, there's this belief out there that the SARS, this coronavirus was made in the lab. I know you will laugh at this because it will sound very strange, but yes, that's what you see. People say, oh, this was made in China. You know, they made it and they want to use it to wipe the world or take over the investment of the world. This is just it's a personal opinion. So what do you think? What do you think? Let me start with you. What do you think? It wasn't made in the lab.
You know what? I don't like discussing conspiracy theories.
Okay.
Yes, because the more you talk about it, the more you give life to it.
Okay.
So anytime any strange thing happens, whether it's health related, whether it's political related, whether it's anything related, there are always conspiracy theories. So it's in human nature to be, oh, why is this happening? And in the process of trying to imagine what is happening, you have different theories coming up. Some put up theories for different reasons, either economic reasons, political reasons. And no matter the kind of theory you come up with, you have people that are going to believe it. No matter how stupid it might sound or how good it might sound, whatever, people will believe it. So I just want to end it there. We have COVID-19. We are struggling to, irrespective of how it came about, is here with us. So let's do what we need to do and get it out.
And let me ride on that to also say part of our duty on this platform and in all other platforms is to pass the right information. All around us, we've seen people die of COVID. So some people who are still doubting the existence, I mean, are doing that at their own disadvantage. Even a high-profile political figure in the league of chief of staff, president, we lost him to COVID-19. So it's genuine, it's real, people are dying. So all effort must be geared towards how do we contain it and at least keep the fatality low and help our people. Because for any life that is lost, I mean, it's a destiny that is gone. And so we should not give life to conspiracy theories out there. They may exist for whatever reason. In fact, people say it's an economic war between the US and China, this and that. They may exist, but truth still remains. COVID is here, and we've got to fight it.
So whatever conspiracy theory, put it aside now. Just open your heart. For those that are listening, just open your heart and listen to what we have to say today.
And like you said, prevent yourself. Those are the things, those self-level prevention. In fact, don't be thinking China,
don't bother about the all the politics and the politics. That's not important.
The virus and the
because if you're not alive, you won't be discussing politics. You need to be alive. Okay, now to a layman, he will say the coronavirus bill. But to the experts, it is the Control of Infectious Disease Bill 2020, I believe. And there's just so much about this bill that has come out. And if you open the media everywhere, everybody is, some people have their own theory that it is sponsored by a particular billionaire who wants to get all of us, who wants to use the African continent to do his research and insert something.
Still part of the conspiracy.
Conspiracy So it's what is out there in the open, and nobody understands what the infectious disease. I have not read the full bill on its own, but I've seen excerpts from here and there, and I don't think there's. I'm trying to wonder what exactly is the problem with this bill and why is everyone standing. Let me start with you, Doctor. So what's this infectious bill about, first of all? The infectious disease control bill, control of infectious disease bill.
Okay, from what we saw in the news, the House of Representatives, specifically Mr. Speaker and a couple of other members, are sponsors of this bill. And in their thinking, they feel we don't have sufficient legislative framework to support the fight against COVID-19. So the spirit based on which they are coming up with the bill is a good one. Yes, the Quarantine Act is almost 100 years old, and
so there's a Quarantine Act already on ground at the moment.
Well, we inherited from colonial masters, so
well, there's so many things
as far back as 1926.
It's almost 100 years old.
Wow.
So
it can't even work now.
So it was based on some components of that act that Mr. President even declared the lockdown and some other measures that have been taken. So the thinking of coming up with an infectious disease control bill is a good one. So, but having made that point, the first response I made about the bill was the timing. That was even before I read the content. I got, very disappointed when I read the content. So I felt the timing, even though the intention was good, but we are in the middle of a war, in quotes. We're still fighting this pandemic. We are in an emergency situation.
We don't even know
a lot of things are happening fast. So, and when you are making any law, the law is being made for the people, not the people for the law. So the people must be part of the process. The people have to be involved. And when in the process of making that law, because the people are involved, they're also learning about the content, they are making their inputs. And when it eventually becomes a law, when the president signs it, the people will also abide by it because, one, they were part of the process. They believed in the importance, So, but when you do any legislation without involving the people, we are heading for a disaster. Because one, even if we are trying to involve the people now, who are the key persons who should even first be part of it? They are the health workers. It's NCDC. You understand? The NCDC Director General said he was not aware of this bill. He saw the copy like 2 days or thereabouts after it has been tabled at the House of Reps. And he also said, in as much as he agrees with the need to have a law around control of infectious diseases to support the work NCDC, Federal Ministry of Health and others are doing, but he thinks that this should be better after now. Because when you are fighting, it's not when you'll be changing the rule in the middle of the game, or even when you've started playing football or any sports, in the middle you change the rule, because the people who are to abide by those rules will not even be very much conversant with those rules. So you will be having more lawbreakers, and and it's going to cause a whole lot of problems. And when I read the content of the bill, my further response was that what succeeds is the dustbin. Yes, with due respect to the sponsors and all that. First is, it was plagiarized, from Singapore bill of 1970 something. You understand? Because I saw both bills and a lot of things were similar, which is very much disappointing that we are paying so much for legislation and to National Assembly to employ aides and help them do some work, and someone will just go and bring a 1970 something law of a different country that is not a country that does not even have a good reputation when it comes to human rights.
Yes, of course.
So during a period where law enforcement agents had killed 21 Nigerians before COVID-19 killed 12 Nigerians, just in the name of enforcing lockdown. And we are bringing a draconian legislation that gives so much powers, endless powers, to law enforcement agents and even to the DG of NCDC. In fact, if I'm the DG of NCDC and I see such legislation, in fact, I will even be scared because it's in such a way that I will look at you and say, I suspect that you have infectious disease, and I can command that you be taken to a hospital or to an isolation center, and you be detained there and you stay for as long as I deem it fit. That's to the extent that bill is. I don't want to think that is the intention of those who are coming up with it. I believe it's a lazy work done by some set of persons. And we don't need to, because of ego, to be going back and forth on this thing. That bill should just be trashed, and another one come up with. Perhaps when we've relaxed a bit, because now health workers are not in the best frame of mind to even read the content. We are in a crisis period.
So your point is, before I even call you, your point is the time is not right. The time is not right to push this kind of bill. We need to know everything we need to know about this before we start pushing this bill. And okay, let me.
For me, it's also a little bit suspect the speed with which the House.
We're looking to pass.
We are looking. We got to know that the thinking was even to give it an expedited passage.
Because it had passed second reading.
Second reading, just they are reconvening. So it gives room for much suspicion. What are you in the past? Those of us who have played in the public health sector in Nigeria knew the hard work you put in to get a single legislation up to the last to get it as a finished product. The National Health Act of 2014 took players almost 10 years. Dr. Laz here was a critical member.
Even though that's absolutely abnormal.
Yes.
10 years.
Yes, almost, such an act shouldn't take a year to pass.
Wait, just before
maybe we should cover National Assembly that they are being fast. They are being but and not allowing it to take
that's what also gives people room to suspect. What is it in this particular bill that, unlike what we've seen you do in the past,
taking 10 years and
not just that, even the National Tobacco Act, all those took a while.
Violence against persons prohibition, 13 years.
13.
So those are not normal. Those are not normal. Yeah, we are not saying that it took. Those are not normal. But for this to have taken you such an expedited passage gave Nigerians cause to be concerned. And then, thank God that the voices started coming out, civil society, players. You need to get the community people involved. The act of lawmaking, legislation itself, has a process. There was no room for public hearing, and you were thinking to.
That's what I was thinking, because there was no public hearing.
So the hues and cries around Nigeria is germane. We need to get people. You are not. The law in itself is not an end. It's got to be implemented on a paper, and the people have got to be involved so that they own it. We talk about in the development sector, there's a language that is popular: community ownership, stakeholder involvement,
so that everybody's easy for them to get involved.
Because if the law is not actually to get more offenders, the spirit behind the law should be have more people who are working in tune with the law. And then you need to get them involved so that they can understand and run with it. And then these things we are not observed. Talking about the language, the content thereof, like Dr. Laz said, you begin to. That law is possible to create.
It rests more like a military decree.
Yeah, it can create a monster out of the DG, NCDC. Because some of the languages there, you cannot objectively measure them. They are subjective. When you talk about the declaration of an emergency in the public health space, and you say the president, if he's satisfied, how do you measure? What are the parameters upon which that satisfaction is built upon? So I can look at you, especially in Africa, or let me say in Nigeria, where we know there are some subtle political fights going on between the two major political parties. I can look at you, you own this facility, and I just say, no, close it down. There is no benchmark upon which that satisfaction is predicated or premised.
Even now, you can still see a bit of draconian between the police force and the, trying to enforce it on people.
In fact, section 23 of that law empowers the police or any other health authority to arrest a person walking on the street of any, mark you, not just COVID-19 now, any infectious disease.
On suspicion.
And if you look at the first schedule that lists all the infectious disease in that law, HIV is among.
Cough and catarrh
is among. So if a police officer sees
typhoid fever,
they're not even well.
Cholera.
So if I'm walking on the street and you suspect me, for example, that I have not just COVID but any of these, the law empowers the police officer to come at me. So these are not something you will expect to see in today's democratic Nigeria. If you want to build a society that is founded on the universal principles of justice and equity, these are not languages that we need to be hearing now. So we need to interrogate that law more. We have to give it room for more stakeholders to make input into it and then get
okay. We'll just go on a break. When we come back, we'll talk a little bit about, we'll talk more on this infectious disease, because we want to see what kind of thing should be in this bill. You know, if you were to advise, what kind of thing should we be looking at in this bill? We'll be right back, viewers.
There are a lot of false information about the coronavirus. These are the facts. People of all ages can be affected by the coronavirus. However, older people and people with pre-existing medical conditions such as asthma, diabetes, heart diseases are more vulnerable to the disease. It is not for old people alone. Gargling salt and warm water or chewing garlic and ginger cannot prevent the virus. Drinking alcohol, hot lemon, palm oil or chloroquine will not kill the virus. The virus cannot be transmitted through mosquito bites. Antibiotics do not work against the viruses. Antibiotics work only against bacteria. Boiling pineapple peels, lime and ginger does not kill the virus. Putting raw onions in rooms will not ward off the virus. Using or spraying Dettol, special oils and water all over your body cannot kill the virus. There is no scientific evidence that cooking, drinking or eating any of these is an effective treatment for coronavirus. Do not self-medicate and take responsibility by sharing only verified messages from health authorities such as NCDC, Federal Ministry of Health and WHO.
Welcome back, viewers. Before we went on the break, we were discussing COVID-19 and we just wrapped up talking about the Control of Infectious Disease Bill 2020. So we still continue on that. So we were talking about the Control of Infectious Disease Bill, which we know definitely, just as you said, in simple terms, should be thrown into the bin. It shouldn't see the light of day. But what kind of thing should, if you were to advise the National Assembly, what kind of thing should a bill of this nature contain? Of course, we don't know everything about this virus at the moment. We're still getting to know more about the virus and other infectious disease. Well, we know most of other this infection is not just COVID-19. It's just because of this pandemic we're in. That's why. So, what kind of things should be contained in a bill? Let me start with you, Dr. Lath.
Yes, the bill provides a legislative framework that will guide response in Nigeria. And that bill have to recognize the federal structure of the country.
Okay.
The current bill does not. It assumes we are in a unitary system or one governance structure, which is why I think the Nigerian Governors Forum had totally rejected it. Because it pretended as if there are no states and local governments and they had no role to play in the control of infectious disease. So National Assembly have been making laws for this country. So, and they understand this very well. I don't need to teach them. You know, they are very competent in that. It's just unfortunate that they did copy and paste on this bill. So that's why, you know, those components didn't come in. So, and also I'm happy that they made it infectious disease, not just COVID-19. So over 45 infectious diseases that are common in Nigeria were listed. So, which is good. Looking at it, most of the actions are at the community level. And the next authority at the community level are the local government. So there should be robust provisions that are actionable, that will make awareness. Because a lot of times people are not aware. The knowledge is very poor. So, and because in our constitution, there is no bites in the health provisions. You just say right to life. And you just infer that, right to life means you'll be healthy. So the bill should make it something that is actionable, that you can sue, that citizens, if I feel that in my local government that we have this infectious disease that always kill people every year, and the local government or the state is not doing enough about it. I can go to court and get a judgment. Yes, you know, until we have, you know, provisions that citizens can take action to compel government to act. It will just be a mere document there that everybody will look away. So awareness is very important. Lassa fever kills Nigerians every year.
And that's the thing.
We had the longest or the biggest outbreak that killed as at early April, has killed close to 200 Nigerians, and that's out of about close to 1,000 infections. Wow. So in terms of even death rates, Lassa fever is more deadly than COVID-19. It's just that COVID-19 spreads very fast, and before you have 1,000 Lassa fever cases, you could have 100,000 COVID-19 cases. You know, so, but what are we doing about this? It kills health workers. 6 doctors, as at 1st April, had died of Lassa fever this year. You know, so if you say in the last 10 years, you can imagine the number of health workers, nurses, and so many other persons that have died. So, and how much do we, and Lassa fever was first discovered in Nigeria since 1969. Wow. You know, so there are these things that should be. Yes, in State. So we should, especially all these diseases that are endemic here. He had already explained the meaning of it. Here they are living here with us. So we should have the knowledge, the way they do campaign jingles during the election, to the extent that if you are subconscious, it will be playing in your head. So let them be doing jingles about all these diseases in the states and within the geographical areas, and even. The private media should also share certain responsibility as part of CSR for Nigerians to have all this information. That is very key to me.
Just like they've done for COVID-19, Nigerians have a lot of information.
Yes, cholera is still killing a lot of people. If you put the numbers, cholera has killed more persons than even COVID-19 will kill in the next 6 months.
I love those points you're making, because the infectious disease bill, it's now is passed just under COVID-19, but there are other infectious diseases.
There are other shadows, in the later part of it, you read.
So it should also be considered.
It should be considered, and the strategy, I know they have COVID-19 in mind. That's why they are putting all these draconian components. But the response to a disease like COVID-19 is not exactly the same approach you use to respond to typhoid fever or common cold or hepatitis B, which are all infectious diseases, or HIV or tuberculosis. They are all infectious diseases. So let's
do something that is holistic,
and they alone can't do this without involvement of people with experience. After COVID-19, we would have gained new experience. You know, Lassa, we already have some experience in Lassa. COVID-19 comes with a new experience because the behavior is different. Meningitis, monkeypox, these are all infectious diseases. You know, so we use all the experience. The professionals will come in, and we are professional. Is not just health professional, even the media people, communication experts, you know, virologists, psychologists, everybody have a role to play in this, even business people, because now it's affecting businesses. So private sector, everybody must be involved to have a very robust legislation.
But all the, just before you go, all the other bills, health bills that have been passed, did they still go through the same process of getting everybody involved, you know, in talking about this? Because I'm just looking for how to pass information. And do they still go through the same process of meeting everybody? Is that how the process is?
There was serious, for the National Health Act, it took long. Stakeholders got involved, series of meetings, a whole lot of stuff. And then, even I remember in one meeting, you were in that meeting, that's it was a retreat, but that was on immunization financing now, and I remember. We got legislators to be part of this, because they have to legislate. And then the people, community people who own those processes were observed. That's the missing link with the issues around this one. But we've got to own up that this is not only speaking to COVID. So we've got to make it more participatory and more holistic, so that we are not in a haste to pass something and end up shooting ourselves in the foot. It pained me personally that there's a whole lot of money that goes into people we have up there. And then they need to get technical people who will look into that the issue of plagiarism, I mean, we shouldn't even be
talking about it.
It's insulting.
I'm
insulting.
Worried that you're bringing.
We have technical people. We have technical people. We have people who understand the issues when it comes to public health. We should be able to advise us better and craft the language of that law. You know, when you look at even that law itself, to a very huge degree, it's inconsistent with the provisions of our constitution.
It's
inconsistent. The language there is, I mean, is derogatory. I mean, and some things are nebulous, vague, kind of. You can't even pick them here. So we've not got to do more work and get out the best out of it, because one of the problems we've had as a country, we make so many laws, but implementation is an issue. Thank God Dr. Love talked about people at the community level. Health is something that the community should own at their level. There are provisions in the National Health Act for individuals to demand that hospitals should provide services to them. We should also empower people at the grassroots, not just the local government chairman, but even union leaders, to be able to know that there's a part for them to play in this. In that way, it becomes our turn. We still have this mentality in Africa and also in Nigeria of government is us against them.
But we've got to... What you're saying now is a big part of it, because I know there's so many laws I don't even know about. There's so many laws about health laws that we
nonchalance.
don't know.
Nigerians just feel it's just government is them and we're here.
Saying, you can demand for something. No, but everybody begs for health. People are begging for their health. They are begging to be treated. They're begging to get...
Imagine
when they've been empowered.
Imagine they, with due regards to his office, the secretary to the government of the republic, in the height of this pandemic, it opened his eyes. He said he didn't know that these wide health gaps exist in our system. So imagine. So we've got to see that Nigerians are the lower. If you check, if you do the mathematics, a country of 200 million plus, and divide it per head, the provisions in the health budget for our citizens, we are not anywhere. We are even not just talking about relative to some Western countries, even relative to some African countries, we are not anywhere.
Okay, so what do we do now to get people to know what they need to?
Citizen participation is key. And that's part of the goal we want to achieve on platforms like this. People have got to demand for their right to health. The Constitution says right to life, but health is also a critical ingredient. When you're talking about life, you need to be healthy and alive. So citizens have got to demand this. We've got to empower citizens by sensitization, creating awareness. It's also important that you go back and read some of these acts so that you know the provisions that are therein for you. Let me give you an example. Most Nigerians don't know that constitutionally, there's a provision for you if you're stranded in a place to go to the nearest police station and sleep overnight if you're stranded. Most Nigerians don't know that.
Would I want to go to the police?
No, I'm not talking about the morality of the many of us are ignorant of the law, and in law they tell you it's not an excuse. If I travel to Kaduna and I'm stranded now and I don't have anywhere, the Constitution empowers me to go to the nearest police station and spend the night till the next day that I get on with my business. So we've got to be people that are literate. I have to know before I demand. So I encourage our people not to be nonchalant, not to be lackadaisical and just feel it doesn't concern me. Our leaders, unfortunately, may not, only a few of them may actually be true to their creed and care. If not for COVID, some people would have jetted out of this country to seek for the best medical options available to them. But COVID kept us all locked in.
And they were realizing how our health system
the inefficiencies in our system.
We live here.
Some people will say we die here.
L-I-V-E. We live here.
We live here. And then, so these issues have got to come up. But let's take a time out and give some shouts out to our frontline health workers. It's important. We've lost people in this COVID, so we've got to appreciate.
Appreciate. Most of health workers they are the frontliners. They are the people that are doing this.
Health workers, security journalists,
the whole team.
All frontline.
I wish I could have people back, because there's the way the security personnel attend to this thing. I feel sorry for them because they don't even know. I know sometimes I had to start educating them.
They also deserve to be protected, but they are not providing them tools.
The personal equipment gears, all the personal protection gears are also in short supply. So these are issues.
So sad. Okay, now I want to talk about vaccine. vaccine, because I know viruses don't get easily treated like that. You know, you can use a combination therapy, you can, but for vaccine, we don't want to, you know, fuel the conspiracy theory, but it's what is out there. So this station, this program, we're trying to debunk some of it. At least we've cleared the fact that, look, it's not because of anything, the whole conspiracy theory, you know, we are dealing with an ailment. But now, the vaccine issue, you know, there was even a time somebody said, I think it was a French scientist who alluded or kind of said that they should use Africa as a testing ground for whatever they had. I know it trended and people were really unhappy about it. So what is the issue with a vaccine at this particular time? Because some people are blaming some billionaire that he wants to insert things in our bodies and he's doing it fast. And also, what's the issue with vaccine? I don't know if my question is clear. Do I start? Okay, let me start with you.
I'm not so sure. Maybe Dr. Laz is also a clinical person. I'm not so sure as we speak there has been a certified vaccine, WHO certified vaccine against COVID. I'm not so sure. So I want to believe it's still work in progress. Some level of hard work is going in to see. But vaccine could be one of the options. It's not just the only option. We've known that vaccination helps. It helps a great deal. Especially back in the days when our parents will have so many children and they say mysteriously people have died. Some of the things that killed children back in the days, we have vaccine preventable things that would have been prevented. So vaccine could be one of the options. But I'm aware that real work, effort is still going on. Until WHO comes at that level, global level, to certify that this is a vaccine, then we can shout Eureka. I also don't want to give credence to conspiracy theories out there. There are some schools of thought that believe that there is something sinister about what is happening somewhere. That the way we've known vaccine. Let me just explain. The issue around how vaccine work is more of getting a weakened virus, or an attenuation. In clinical language, we say attenuation, getting a weakened, and then introducing it to a host. The next time that same foreign body comes in, then your body is provoked because it recognizes it, and then you generate antibody against it. But the conspiracy theory out there, which we don't want to give credence to, saying that this is not what, that this is more of genetic modification that some people are trying to promote. But like I said, it's neither here nor there. Until WHO, who are technical people, who have technical people in their team, is able to satisfy that this is it, then we will run with vaccine. But beyond vaccine, there are other options that could be exploited. Some countries in Africa have come out to say, even a governor in our climb told us, I did this, I did that. We don't know. So these are issues around. It's neither here nor there until we able to satisfy. Mind you, COVID is still something that all of us are still studying. We are in it and we are studying it. Until we get a clearer picture, we'll be able to say this is the way for the world to go.
Okay. So Dr. Laz, the vaccine.
Well, I don't think there should be any controversy around vaccines. I've worked on immunization program before, so all these conspiracy theories are not new to me. You know, but perhaps we are hearing it because we're working as health professionals within that sector. Now people who have not heard these things before are beginning to hear it. So as far as 4 years ago, I've been hearing some of these conspiracy theories, and it has not stopped people from taking vaccines. One thing is, like he said, immunization is very important. And from day one, from birth, people take BCG, hepatitis B virus.
It has saved.
Absolutely. Smallpox was eradicated with vaccines. We tried to see, could we find...
for our country, for polio, it's vaccination has helped.
Over 3 years now, we've not recorded a case, you know. So
and we may soon be delisted if we maintain that
record. So there's no doubt that we need vaccines for any disease that we can't find one for. It's not every disease that even after all the research that you're able to, you know, for any kind of disease that comes and kills people in this way, or causes deformity, because polio causes more of deformities. You know, you try to find a vaccine against it. Some you do all the research, and at the end of the day, you may not find one that works. We don't have a vaccine yet for HIV, not because there's not been research or efforts to come up with one, but we've not been able to find one that's, if you take it, then it will prevent HIV. So it will take at least 1 year, and 1 year is that we even find one quickly. You understand? Before it goes through all the processes.
Clinical trials.
Clinical trials
takes a long time.
It takes you have different stages, 1, 2, 3, up to 5. Because first you test it in animals, biological this thing, and if you see something before you even move to the level of human, and if the first you could do like 15 to 20 persons. Next stage perhaps 20 to 80, next from 100 to 300, you understand? Then you now go the mass one, and you don't just do it in one place. If you are doing clinical trials, you do it everywhere, because if you get people in Nigeria and try a medication on them, whether it's a vaccine or a drug, and it worked, you might go to Atlanta or to Pakistan, get persons, and you give to 20 persons and 5 dies, because we are interacting with the environment. There's a relationship between our health, our body system, and the environment. So it's important. People should not be scared if there is a trials to happen for any. This is a global problem, and vaccine is trying to find solution. So we should be part of the global solution. I'm a senior advisor to the University of Nigeria Center for Clinical Trials, you know, and that's the first in this country. So it's actually trying to promote, not for you to develop drug elsewhere.
Bring it here.
You approve it, you bring it here. Maybe from experience, we start noticing that, oh, it's causing some deformity in people here. So we want at the level of clinical trials for it to also be tried here, following the standard international protocols. And nobody is forced to be part of a clinical trial. You volunteer.
What,
you know,
what organization this is? Because I've never heard it
University of Nigeria Center for Clinical Trials. You know, it's part of the University of Nigeria College of Medicine. So at the moment, you have one in we have in South Africa. This is the first in West Africa that University of Nigeria just started. You know, it's to be able to, for any drug or vaccine that we take, whether it's paracetamol, whether it's vitamin C, you know, for anything we take as medication, it goes through that process. And it's just to ensure that the benefits outweighs whatever side effect. It's from those trials that you'll be able to say, oh, the side effect is headache or mild itching or those, even despite those side effects, but it cures. You understand? So you can make do with some of those potential
risk-benefit analysis, all those kind of,
you know. So these things are nobody.
So some effort is we're trying. We're making some effort.
Yes, you know. So let's all this hysteria around this thing. There is no need for that. The Federal Ministry of Health is not going to stamp any product that will come and kill our people. You know, yes, I know people don't trust government, but it hasn't reached to the extent of people, because if I'm the minister and I approve it, my relatives will be victims. So many my friends will be victims, and I can as well be a victim.
That's why I was kind of elated in one of the PTF broadcasts, the Presidential Task Force on COVID, and they were focusing on the issue of how do we grow homegrown researchers in this field. Perhaps that might be one of the things that COVID has thrown to us. We need to invest more in our research institutions. It will go a long way to help us grow home-based solutions to some of these issues. And we have
works well with our own environment.
And we have experts in this field in our country. It's just to do that little push, needed investment, and then we take it up from there.
Okay, so because we'll soon be rounding off now. What to talk about?
Sorry, there's something Lars said that brings me back again to the issue of that infectious disease bill. He's just said nobody forces you to participate in trials. In medical ethics, we have issues around informed consent. You are willingly, the language is clear to you, you understand what you're going in for. And if you look at the provisions, some of the provisions in this medical bill, there are certain aspects of it that seems to negate that.
It doesn't allow you an option.
It doesn't give you option. Is wherever the NCDC DG deems fit, with or without your consent, that it takes you to have these issues, you get you vaccinated because it talks about vaccination. So you see why the resistance, so much hula baloo around the veil.
They don't pass, I'm sure, because so many people have gone against it.
Because you don't have to take away that issue of consent, that willing participation is critical. It's critical in ethics.
So we want to talk about the method of prevention of coronavirus. We'll talk about the infectious disease bill. We talked about vaccine, which I think I like the way it was well explained, how it was explained. But let's talk about prevention. Now they tell us you wash your hand. They tell you wear your nose mask. They say you should maintain social distance. But the thing is, wash your hand, wash your hand. What does washing of hand, what does it do to prevention of the coronavirus? Now, why I'm doing this is so that when you're washing your hand in your mind somewhere, you know what you're doing. You're washing your hand. So, do I start? Okay, let me start with
let him start
Okay, hand washing is one of the simplest and a very effective public health measure for prevention of any type of infectious disease. In fact, we even have a global hand washing day that the United Nations declared a day to encourage and discuss the importance of hand washing. So whether it's COVID, whether it's Ebola, whether it's Lassa fever, whether it's cholera, whether it's typhoid fever, whether it's hepatitis B, many infectious diseases you can prevent by simple washing of hand with soap and running water. So because these things are very tiny, you have no control over where they are in the environment. So as long as we interact with the environment, there are chances that we pick up germs, viruses, bacteria, fungi, so they live with us. So, but you may pick them up, fine. They can be in our clothes or in our hands because hands touches a lot of things. But hand washing makes it that you can control the thing entering your system. So it simply stops this wherever it is when you wash your hands. It's even more effective than use of sanitizers.
Yeah, because people will see water and go and use sanitizer.
And they will use sanitizer.
No, it's washing
hand
first.
Washing. Even the NCDC message say wash your hands. But where you don't have facilities for proper hand washing, use alcohol.
Because even the hand washing has to be with running
water. Someone can be pouring it because we know we don't have taps in those places. So someone can pour it for you. But there are also issues around availability of water and things like that. So
let me just say the issue around distancing. Part of it could be because we knew this virus don't travel on itself. It's human beings that as you travel along with it. So maintaining that, I'm hearing now, is should be called physical distancing, no longer social distancing.
All right. So just quickly, we just have to ask a quick question from we've had previous episodes, and somebody sent in a question, and he says he just discovered that he has high blood pressure. What do you advise that this person should do? He just discovered that he has high blood pressure. I'm trying to wonder how...
Self-discovery or...
that's what I wonder. Is it self-discovery?
Well, you can only know that blood pressure is high when you check for it using a sphygmomanometer and all that. So if it's high, it depends. I don't know what the reading is, but what we are taught in med school is you check BP is high, and you can ask the person to rest for 4 hours, and you check again because there are things that could temporarily make BP to go up and to return back to normal. But there's a level it will be if you do a BP and you find it 220 over 110 or 120. That one is not just perhaps a temporary distance. So if the BP is high, go to a hospital, see your doctor, let them investigate and know what it is, and you take it off from there.
The answer is see your physician.
Yes.
Go and see. That's the only place. So see a doctor, and that's the only person that can tell you
what
to do.
Because many times you will not show any symptom, and when you begin to show symptom, it's either damaging the kidney or the heart, and can even cause blindness.
So we give no room for self.
Just go to the doctor. In this case, don't try any. Thank you very much for coming on the program. The time has gone so fast. I wish I could just have you remain here for some time, but thank you so much. So thank you, viewers. That's all we can take today. For the past few minutes, I've been speaking to Dr. Lars Udeze. He's a public health analyst, and then the publisher on talkhealthniger.com.
Nigeria's first pidgin English health
Nigeria's
blog.
first pidgin English health blog. So I think we should check it out. So Talk Health Niger is in 9ja.com. Check that out and then hear more information, you know.
More information.
That's the way we say information. Yeah, it's Pidgin English blog. Yeah,
and
you like it. And
also been joined by Chukwe Bukam Ejekam. He's a presenter on ACNN. In fact, Bible study to be precise. So thank you for coming on the program.
Thank you. Thank you.
And I am your host, Angela Nweze, and we'll call it a wrap now. Thank you for joining us. I'll see you next time. God bless you. Goodbye.